Good evening. Good evening. Welcome back. It is blackdoctor.org, of course, and we are here doing another Facebook Live. You guys probably didn't know, but this month is Hair Loss Awareness Month. So today I am bringing two fabulous experts in hair loss to talk to us about that. And, men can have hair loss as well as women. And I think both sexes are just as equally, devastated by it when it happens. So I hope that you have brought your questions and concerns. And please, as I always ask you, please don't forget to start your watch party. I am trying to find my banner to remind you. Here it is. There you go. Don't forget, start a watch party. Tell your friends and family. Make sure you like the page. Give us a thumbs up. Throw us some hearts. Thank you so much. And I am so excited to have these two guests. So they are really, like I said, we got the experts, you guys, and we need to talk about Black women and Black men hair loss. So we got Black people, obviously. So here we go. So we have with us today Dr. Michelle Henry, who you guys have seen before. She was the one that talked to us about acne. You remember that mask acne? And after that, I saw her on Good Morning America talking about it. So we have a real celebrity in our presence today. And then we have Abra McField, who you've also seen before, talk about hair growth. And now she's actually went further with her education. So now she's not just a stylist, but she's now a trichologist and hair loss practitioner. So thank you, Abra, for joining us. Thank you, Dr. Michelle, for joining us.
Thank you for having me.
So, ladies, let's get right into it. So, Dr. Michelle, since you are the dermatologist, I would like you to please tell us the different types of hair loss for men and women, that especially in the Black community. And I know there's a lot, but the top ones.
So the top, and I'll talk about, I guess, what we see more commonly in the Black community than we do in Caucasian communities and whatnot. So the first is CCCA, so it's central centrifugal circumferential alopecia. And so most of us have seen that. So it literally starts on the center of the scalp, it spreads out slowly, and it's scarring and hair loss. Of course, alopecia is just a descriptive term for hair loss. So it's very, very common. It's hereditary. So we inherit the tendency that we believe certain things in our environment trigger it. So once upon a time, we called it hot comb alopecia, and then we thought it was relaxer alopecia. There's something about our unique styling practices that causes us to come forward. We also suffer from standard male and female pattern hair loss. We call that androgenetic alopecia. And so androgenetic alopecia is also hereditary, and it's sort of, you inherit a sensitivity to your own testosterone. So we see it in men. We can see it in men really early in life, but also in women. We can see it as early as our 20s. So that with women, it kind of presents as generalized thinning throughout the scalp. It usually preserves the temples. In men, it's kind of that classic, we lose the temples first, then we start to lose the central scalp. And then some men can go completely bald with androgenetic alopecia. And there's also a hereditary component. There's traction alopecia or tension alopecia. And so we often see that on women, when women say they're losing their edges from styling or braids or weaves or wigs, that's traction alopecia. So that's from traction and pulling and tension. There are a whole slew of other scarring alopecia. So there's a frontal fibrosing alopecia. So that's a type of hair loss where you start to get scarring hair loss on the front of the scalp. It also includes the eyebrows. It's a variant of something called LPP. It's another kind of alopecia, lichen planopilaris alopecia. And that's when we're getting scarring alopecia of the scalp as well. You get really red follicles. So we can go on and on and on. There are many types of hair loss, but those are probably some of the more concerning and that I see more often in the Black community.
And so we in our audience, we always have lots of people that, are like me, who I'm going to come to the doctor and I'm going to, whatever drug you prescribe me, I'm going to take it. But there's also a whole lot of people who are really into a more natural approach and, they want to do things more holistically. But I know for a fact that the dermatologist and your trichologist, they can work well together. Mm-hmm. And make a world of difference. I know from experience, I know that works. So, Dr. Michelle, can you talk about how maybe you work with people like Abra to help your patients? Because I used to take shampoo from the dermatologist that was prescribed. I used to take it to the salon and they washed my hair with this specific, shampoo because
Yeah, I mean, so it's a really important relationship. So oftentimes, you know, a lot of my patients see their hairstylist more than they see their dermatologist, of course. And so in many ways, their hairstylist is the first to alert them that they have a type of hair loss. And so oftentimes, a lot of the hairstylists I work with are fantastic. So they're able to tell if they think this is just shedding. They're able to tell if they think this is more of a kind of female or male pattern hair loss, if this is due to tension. And they'll talk about, you know, changing their styling practices. And they can also tell if they think that it's more severe, so something like a scarring hair loss. And so oftentimes that's when they'll start sending them into the office if they think that, you know, this goes beyond something that can be adjusted with styling or things that we do in the salon. They may need some, you know, more significant medical management. So we work really closely together because it's really important, because they're going to have eyes on a lot of those patients before we can ever have eyes on them. And then we work together on the back end as well. So after I've made a diagnosis, if it is a scarring hair loss or if it's a traction or tension hair loss, you know, I really only send to stylists that I know can handle tension hair loss. So stylists who understand what styles are appropriate, how long they should keep those styles in, you know, what kind of tools they're using, how much heat they're using. Stylists that are really, you know, keen, you know, clinicians in their own right, in seeing if it's progressing or not, if their scalp is showing signs of, you know, increased activity. So it really is a really important relationship for us to work together and make sure that, you know, we're keeping those patients safe and we're not allowing their hair loss to get to a point where, you know, we can't restore that growth.
So Abra, can you talk about what you do for your clients?
Okay, so I am a trichologist, and a trichologist is kind of like a bridge between cosmetology and dermatology. Cosmetology, obviously, we're concerned about your hair, the look of it, the manageability of it. A dermatologist, more concerned about the science of it, and some deeper issues that you could be having. And so a trichologist is in between there. We kind of know the science, and we are emotionally invested and work with you to manage your hair loss issue. And it's not necessarily just hair loss issues. Also, it could be like actual scalp issues, like seborrheic dermatitis or psoriasis, that can be a contributing factor to hair loss. So a lot of times when my clients are coming in, we are diving a little deeper with examinations. We're doing microscopic evaluations. So I kind of get up very, very close to the scalp, an area that can't really be seen with the eye, and trying to assess what the issue is. I dive deeper into nutrition, lifestyle, history, because a lot of us don't realize that we have a lot of androgenetic issues that are going on that are contributed to our parents, and or that come from our parents and grandparents and things like that. So I kind of help bring that into perspective and kind of walk through a system and a program, 3 months, 6 months, even a year sometimes, depending on the severity of the issue, and constantly doing follow-ups. So I'm just kind of emotionally connected. I educate the client on what issue they are having. And then with our follow-ups, we're always taking the digital photos. We're always doing follow-up microscopic evaluations and compare the two. And that usually builds some sense of confidence, because usually when they come in, they don't have any hope. So I'm kind of here to help establish some hope and to give them some confidence. A lot of times, in some situations, you know, depending on the situation, depending on how bad it is, how long it's been that they've been experiencing hair loss or alopecia, or how old they are, there's a lot of contributing factors. Sometimes, you know, growing 100% of the hair back is unlikely sometimes, but I feel like if you grow 80% or 60%, my clients and customers are usually really, really, really happy with that. So because sometimes with women, especially, men are a little easier, but women, it's always more than one issue. It's hardly like ever just one issue. We have so many things involved: hormones, the things that we're doing externally with our hair, just stress and genetics and scarring. So I kind of help nail down what those issues are, help prevent it from getting worse, and then try to help reverse it throughout the process. So that's kind of what a trichologist does.
So you guys, I know from firsthand experience about hair loss. And of course, like you said, Michelle, it was the stylist that said something. It was the shampoo girl, actually. She was like, your hair is falling out. And you know how people, Black people, your hair could be falling out and like 2 strands hit the floor. And so I really thought she was exaggerating. I'm going to show y'all some pictures. I don't believe I'm about to show these pictures, but I'm going to show you these pictures and you will see my hair. So you guys, this was the right side and the left side of my front of my hair. Those are my little nubs, my little fingers. I live alone, so I had to take the little pictures and send them to my mother to say, what is going on with my hair? So my hair it still is, but it was completely natural. And I literally ended up with these 2 spots. And actually, this is a little bit after it started growing back. It was actually completely clean. And it was like 2 silver dollars one on each side of my head. I wore headbands. If anyone knew me, I wore headbands every single day for a long time because I was hiding this. So that was my hair. And it was rough. I said, Lord, when I showed my mom, my sister thought it was painful because it was so raw looking. But I was like, no. And we tried, I think I got a cortisone shot. We did a biopsy. So it was non-scarring alopecia, clearly, because I have hair now, but it was scary. So this is January of 2017 when I went and sat in Abra's chair. And this is my hair. If you see, the back right here is all very short. And I have another picture to show you, but you can see how it scoops out here. And then this is it close up. So it had balded again. This was in the back though. So I guess because it was the back, I didn't pay as much attention to it. But when I went and sat in her chair, I was like, I don't know if you can braid this, but here we go. So this is when I sat in her chair, January 2017. And then this is November of 2019. And so this is before Abra became the trichologist too. So clearly she knew what she was doing because she has grown my hair leaps and bounds from where it was. But here's some other clients that she has as now that she has her hair loss clinic. So you see here, her middle part, you see how wide it was, and now it's closing in. So that was lovely.
Yeah, she was really happy about that.
And this lady, you could see just from, her edges were, they weren't really there. And now she has hair.
Yeah. And these are after about a couple months. So usually depending on the hair loss issue, if it's completely gone, then it's going to take quite a few months for it to grow underneath the epidermis, which is the scalp, before it actually starts to protrude out. So depending on where it is, it could take longer. But those happen pretty quickly, and so did this one.
Yeah, and this is a man. Like I said, not only women, men too, you guys.
Yes.
And I'm sure, Dr. Michelle, you get men that come to you as well that are saying, wait a minute, what's going on here?
Yeah, we see a lot of men that are distressed about their hair loss, a lot of young men, a lot of older men. So yeah, men are a huge percentage of our hair loss population.
So we had a few questions. One, I think, Dr. Michelle, you should take hair loss during menopause.
Mm-hmm.
So is there something they can do about it? She said, is there any help for hair thinning and hair loss during menopause?
So it's tough because hair loss during menopause happens because, your hormones are changing. And so effectively your male hormones are a little bit higher. If we were to test your blood, your hormones would not be high, but effectively they're high for you. So because that testosterone is a little bit higher, same reason we start to get a little hair on the chin as we get older. We start to lose our hair, it starts to get thinner. So there are some things that we can do. Of course, if one takes, hormone treatment, that might help as well. I like things like actually Rogaine. Rogaine is great for that because it really helps to stimulate some hair growth. If one is opposed to something like Rogaine, sometimes I recommend even rosemary oil. There's some studies showing that rosemary oil is equivalent to 2% Rogaine in folks who don't want to try it. In my office, I also do PRP, which is platelet-rich plasma. And so that's where we draw your blood and we spin out your platelets. The platelets are a rich reservoir of growth factors. And so once we get all those growth factors, we inject them into the scalp. So that's a treatment we use as well. I also compound different types of minoxidil. So minoxidil is the main ingredient in Rogaine. I'll compound it with a little bit of turmeric and a little bit of lavender because they're both anti-inflammatory. And we see in women more than men, even androgenetic alopecia is more inflammatory than in men, where in men we don't really see inflammation, but for women in some reason we do. So I'll always add something that's anti-inflammatory. I do red light treatment as well. So red light is has been shown to reduce inflammation and increase the caliber of the hairs. And then of course it's what you're doing once you're growing hair. So your hair can become more brittle, more dry. Those strands are thinner, so they're not as resilient. So you have to make sure that you're using good products and make sure you're maintaining your moisture protein balance. I often try to reduce chemical treatments at that point as those hairs become thinner and they're not as robust as they used to be. But we have a ton of things that we do. Supplements that I like. One that I do like is Nutrafol. It has a little bit of something called saw palmetto in it. And saw palmetto kind of works like Propecia. So it helps to kind of block your that interaction between your testosterone and your scalp. And so a lot of my patients will take that independent of the Nutrafol, which is lovely, but it's a little bit expensive. So for those who don't want to spend the full thing, might get saw palmetto on its own. So we have lots of treatments that we use for it. As Abra was talking about, there are some lasers that are growing. Some that I prefer are those that really do kind of stimulate collagen. So they cause little superficial wounds in the skin. Whenever we cause a wound in the skin, it tells the body to heal. And when it heals, it kind of releases all those good growth factors, kind of like PRP. So there's a lot of things we could do, but it requires a proper assessment in order to.
Someone asked about PRP, so I'm glad that you covered that. Someone else said something that I always seem to notice too. They had weight loss surgery and they're having hair loss. Mm-hmm. Do those go hand in hand?
So any shock to the body can cause hair loss. So we're actually seeing a lot of that now with like COVID, just from the stress of COVID. Or if someone has COVID, we're seeing hair loss after COVID. And so we call that telogen effluvium. And that's just any shock to the body. Your body goes and puts those hairs into a resting phase and then doesn't go back into the growth cycle, it sheds them. And I kind of think of it as when our body's under stress, it looks to conserve all the things that are important. And unfortunately, our hair is not that important to our body and sheds it. And so we can see telogen effluvium after delivery, after surgery, which bariatric surgery is included in that, after really any mental or physical stress. So any, dramatic weight loss, anything like that can really cause telogen effluvium. So it is very, very common. So much so that bariatric surgeons even counsel about it. Typically they do before you go through the surgery.
That's what I figured that they should, because I know I've noticed a lot of people that's one thing, their hair starts thinning as soon as they have any type of surgery. So everyone is asking if you guys do virtual appointments. We are definitely going to make sure that they give their information by the end. And everyone wants recommendations in their cities for either dermatologists or trichologists. So we will definitely make sure you guys have their information. I'm going to put their websites on the screen as well. But Abra, what are some of because I told you we have some people that are more on natural approach, and I know Miss Abra is a vegan. So, so what are some of the natural things, because you talked about, talking about their diet. What are some of the more natural things, and Dr. Michelle mentioned some things too that people can take in to hopefully help them if they notice some hair loss?
Well, one of the main things I do, again, I try to take a multi-therapeutic approach to reversing hair loss issues. Sometimes I feel like we just try one thing and that's it, but it's not that simple. So I always get my customers or my hair loss clients on a product system that's going to help support them throughout a certain period of time. Either 3 months, 6 months, 9 months, 12 months, depending on severity of the situation. A lot of times those products have their shampoo conditioner, they have DHT inhibitors in them. So Dr. Michelle mentioned saw palmetto, which is a huge natural organic DHT inhibitor. They're going to include supplements because a lot of times it's internal. So the supplements have DHT inhibitors in them, 11. I have my own product line is actually launching in October 15th. So the supplements have DHT inhibitors in there, 11 of them, marine growth complex, vitamins. Sometimes a lot of us just take vitamins and we think that's sufficient enough. Sometimes vitamins only fill deficiencies. So it's improving the quality of the blood that's flowing to the follicle. But if you have like if you're predisposed to androgenetic alopecia and it's blocked, that won't quite help you because it's blocked. So the follicle is not actually having access to the quality of the blood. A lot of times I like to try to reduce stress in a client, try to get them to see things in a different light. That usually helps because our thoughts are powerful. And I believe that the thoughts that we have are directly related to the issues that we're having with our body. So changing one simple thought can help shift hormone, can help shift stress. And I feel like that also helps. Even what you are taking into your body, like Dr. Renee said, just being very cautious of acidic foods. She said I was a vegan. Yes, I'm definitely a plant-based eater. When you're a plant-based eater, and I say plant-based because it's not supposed to be stressful. I'm not like a diehard vegan, like, please nothing animal touch me. I just try to, instead of focusing on what not to do, I focus on what to do. So if it's very hard for you to just kind of shift your eating habit, just try to make sure, focus on getting more vegetables in, or more fruits in, or more herbs in. So we focus on that, water intake, and things like that. So again, like Dr. Michelle said, she went into PRP, which I do like a moderate version of that. I don't really draw blood, but I do microneedling treatments, and I add growth factors in, which are like stem cells, to kind of help speed up the process or speed up the cellular activity with hair growth. And then laser or low light level therapy treatment, which is a form of biostimulation that's 100% effective. It's non-toxic, non-painful, and just doing a few of those treatments to kind of help support along the way. So those are a few of the solutions that I have.
Okay. So we had someone else just said, hello, my hair is coming out when I wash it or even comb it. It just started coming out the last 2 months really bad. I also have dry scalp and tender and sore. Either one of you want to take this?
Oh, we could tag team it.
Okay, I thought so too.
It sounds to me that, it's hard with just this description, but tenderness, soreness, and the center of the scalp, often to me, first thing in an African American woman, is usually exactly inflammation and central centrifugal circumferential alopecia, which to me is a hair emergency, because our treatments. So what we do in the office for that, I will do steroid injections. I will sometimes, some patients, we're not even able to control them with injections. I have to give them real medications that aggressively reduce the inflammation. But it's a hair emergency because the medications are better at stopping it than bringing back the hair. It works to bring back the hair, and working with me and working with their stylist together, it's a long process in getting their hair back. But, stopping it is critical. So the minute you see it, the minute you're noticing that you're having that tenderness, that burning, it often starts out with just pain and burning. You can't figure out why. And that hair just keeps breaking. It's not completely bald in that area, but it's just breaking and it's short. It looks kind of like a fringe. That's the first sign. And that's when you need to come in, because before it gets completely bald, we have so much more room to make sure we restore all of your hair. And even if it is to a place where it's kind of bald, we can restore some of it, because we never know how far the scarring has gone. Is it early and the hair is just fallen out, or is it completely scarred? We don't know how much inflammation you have, so sometimes we do a biopsy, to make the diagnosis, even though we can oftentimes make the diagnosis without the biopsy, but to tell us how far along you are so we can give you a better gauge of the prognosis. So what it sounds like to me is that, but it could be a lot of things. So dryness can be, seborrheic dermatitis could be dry. It's usually greasy and thick. Psoriasis could be dry. But when you're saying that you're tenderness and soreness usually, to me, means inflammation, like we both said, and a CCCA.
Yeah, I agree. I agree with Dr. Michelle. It could be so many things. It could be a change in your diet. It could be, stress. You could have changed the products that you're using. A lot of us don't realize that a lot of products that we're using creates irritation on our scalp. And then we go 3-4 weeks without properly shampooing or conditioning. And that could just make things worse. A lot of times with my clients, so I do two things. I do have a hair growth system that I use in my actual hair salon. And it's so funny that when I got into trichology, some things kind of not necessarily contradict, but you can't, when you are vulnerable, when your scalp is vulnerable, you can't do the same things that you would do when you are not having any type of hair loss issues. So a lot of times when you are experiencing any type of hair loss issues, or if you have it in your family and you're getting older in age, and it's just that time, hormones are changing, menopause is coming, a lot of the times you will experience like excessive shedding, inflammation, and a whole bunch of other things like throughout that process. So the key is really just trying to prevent it, like reducing the inflammation for sure. So I would highly recommend seeing a dermatologist for that. But just simple as using the right product with the ingredients that don't cause irritation for going forward long term would be major. Again, I have a shampoo, hair, growth support shampoo that has DHT inhibitors in there. I can remember when I first tried it. I don't. So let me say this: I haven't experienced any hair loss. Okay, so even with me testing it out, in 5 weeks, I reduced my shedding by like 50%, and then like in 7 to 8 weeks, it was down by 75%. Even with me wearing it natural and not wearing it natural, a lot of times your hair shed, it doesn't allow for the shedding to actually come out. So you should see more when you actually shampoo. And I was seeing like way less. And so, and that all goes into the type of ingredients and the support. That's why it's called the growth support shampoo. It has the ingredients in there, and the lack of the ingredients that would normally irritate the scalp. So definitely will take more of an examination or evaluation to kind of assess what the actual issue is. But yeah, it could be, well, unfortunately for women, oh God, it could be so much. Men are so much easier. But for women, we usually have to dive a little deeper. And like Dr. Michelle too said, our body thinks that our hair is the least important on our body. So if you're anemic, if you're low in iron, your body, your hair growth, in order to have hair growth, you need oxygen. But if any of your organs need that oxygen, they're going to pull it from your hair. Unfortunately, your hair would see a loss with that process. So,
somebody said, is there any evidence of hair issues that show up on one's face? And I'll never forget when I was a child, the dermatologist, I had something on my nose, like some blemish or something. And she said, that skin is the skin on your head too. And she ended up because my scalp had issues, and she gave me something for my face, and it was, for my scalp too. So I think there's a link there, correct?
Yeah, I mean, there are certain conditions you can see on the face. So you can see like seborrheic dermatitis. You can often see scaling around the nose and the eyebrows. And often if you have it there, you likely have it on your scalp as well. Frontal fibrosing alopecia, classically, you lose the hair along the frontal hairline, scarring. But I always ask my patients, have you also lost your eyebrows? Have you also lost the hair on your body? So losing that is oftentimes a strong indicator that it's frontal fibrosing alopecia. So those are some big ones. What other ones are there? Those are probably the biggest ones that I'm thinking. If I'm missing something, let me know. But those are the top two that I think of seeing things on the face. Also with frontal fibrosing alopecia, you can get this kind of like cobblestone kind of bumps on the cheeks. And so seeing that and losing your eyebrows, that's a hair emergency. You need to come in. It might be frontal fibrosing alopecia, but it's similar to CCCA, that's scarring, and we want to stop it. We're better at stopping it. We can stimulate some hair growth, but if we can stop it, that's the way to go.
I was just going to say, so the biggest takeaway today, you guys, is if you notice something, please find a dermatologist, a trichologist, somebody to examine your scalp and look at your hair closely, because the sooner, the better. And I mean, honestly, pretty much everything we talk about on Black Doctor, the sooner you find things, the better your outcome. You've got to find it soon, quickly, and get it done. Because what you don't want, like she said, you don't want to go so far gone that they can't bring it back. There was someone that said they had brain surgery and the hair just will not grow back. But if brain surgery is in 2014, I have no idea if it's too late. That was 6 years ago. But you definitely, if you notice things, you need to say something quickly rather than waiting. Because when you wait, that's when it's like, well, there's nothing else we can do. It's not coming back. And I think when the shampoo girl said something. I was like, like I said, I was like, what is she talking about? Then one day I ended up looking at pictures on Facebook, no, go figure. And I saw that my big natural curl had started to shrink down. And I showed my mom, she goes, oh my goodness. And so that's when I went to the doctor, because I was like, oh, clearly something has happened here. Because what I thought, because I was working out, you work out, you sweat, and it shrinks. So I just felt like it was shrinkage. I didn't realize that it wasn't stretching back out. So, that's what made me go, wait a minute, I need to go and see somebody about this. And so that's what put me on it. And I also will say, and this is the other reason why we say, please speak to your doctors when you take medication. So if Dr. Michelle prescribes something, you need to make sure that your other physicians know as well. Well, I was like, I can't lose my hair. I'm a Black woman, our hair is our crown and glory. My hair is falling out in the front of all places. So I start taking every supplement I can find that I've heard is supposed to be for hair loss. And I was watching a certain doctor on TV, I won't say who, and I heard them say you should take this for hair loss, and I took it. And all I know is I went to my annual exam that year, and my doctor called me and she said, Renee, you don't have a drinking problem, do you?
Oh no.
I go, no. She goes, your liver enzymes are very elevated. And I go, oh, I don't know why. She goes, are you taking anything? I tell you, doctors make the worst patients. I hadn't told the lady what I was taking. So I was like, oh, I'm taking primrose oil. She goes, Renee, stop it. Don't take it ever again. She was like, you're going to mess up your liver. I was like, well, Mom, I guess I'll be bald, but I'll have a liver.
No.
So this is why it's really important, you guys, that we do tell the doctors exactly what supplement. So if it's saw palmetto, that's fine, but just make sure you tell your doctor so that you know that that's not going to interact with something else you have to take, or it's not going to affect your blood levels in some other way. So just a word to the wise, lesson I learned, that you need to make sure you let them know. But I was eating raisins because I heard that would help. I mean, it was ridiculous. My mother's like,
you're working hard.
Oh my God. I was like, I am bald in the front of my head. Mom, this is a problem. She was like, okay. And I was like, okay, I just got to do something. So,
yeah.
So I was, like I said, I was trying everything. I said, we got to get this hair back. So, and, yeah. And so, go ahead.
I would like to add something, because you mentioned that, one time your fro was like this, and then it then shrunk down, and you had a hair loss issue. But sometimes I think women we ask ourselves all the time, oh, my hair just stops here and it just doesn't grow. Like, it always stops here and it doesn't grow. But you don't realize that we have a cycle. We actually have like a hair growth cycle, and our hair will grow. 88% of our hair will grow, then it will go into a resting phase, and then it will shed. But as it's going through that cycle, we have more hair strands that are coming up through the same follicle. And so a lot of times when I actually, this is a microscope here, I kind of use this to kind of microscopically evaluate the scalp. And a lot of times you'll see someone who may have 2 to 3 hair strands in one follicle. They're always shocked, like, oh, what's that? Or you'll see a lot of times someone who's suffering from hair loss or thinning, they'll only have 1, or the follicle just completely would have closed up. But to this point, a lot of times we have different growth rates. So for an African-American woman compared to like a Caucasian woman, my growth rate may be 2 years. A white woman or a Caucasian woman may be 6 years. And so we wonder, oh my God, why does their hair grow so long? That's because they're losing less hair in a longer period of time, where we're losing more hair in a shorter period of time. So that hair growth cycle, and I hope, I hope you understand that, but it'll take, for example, this hair on my head, if my cycle was 2 to 3 years, in 2 to 3 years, most of this hair would not be here. It would have shed it. And new hair would have came out. So essentially it's starting over. Your hair is not stopping. Your hair, your hair growing just doesn't stop unless you have a serious, genetic issue, or you're just not living anymore. So it's definitely growing, but sometimes it's starting over. And so those are one of the things that I really picked up very early in my hair career, in my hair salon. And even in my hair loss clinic. And so the key for me is, for my solutions, is to prevent you from losing less hair in a longer period of time. And that's how I've been able to be as successful as I am with hair growth. So.
And honestly, you guys, I will tell you, this is the longest my hair has ever been, thanks to her. This is a sew-in. So my hair, as you saw in the picture, is down my back. And this is the longest it's ever been in my entire life.
Yeah.
So,
Yeah,
and I never thought, because I think my hair
usually
usually was about this length. I never thought it could be longer than this. So I was very grateful and was like, oh my God, I have like a lot of hair. Wow.
Yeah.
So.
And we get that reaction all the time. If you all ever get to visit our page, you'll see people crying, yelling, and screaming, and in shock, because all of our life we grew up thinking our hair cannot be long. And right. I just refused to adopt that belief system. Like, I was very determined to reverse that belief system. And so again, I really nailed down on what are our issues. And one of the things I knew is that on a hair level, on external environmental level, I know that we need to keep our hands out of it a lot of times. On a scientific level, I knew that we had to extend the hair growth cycle, so help you to lose less hair in a longer period of time. So that's what my products do, and that's what our unconventional hair growth systems in the salon do in our salon. So
this is the landing page for her products, you guys. So if you are interested, here's the information. And if you would like to check out Dr. Michelle Henry, who does do virtual visits, because we in the land of COVID, all of a sudden, it became something that she did for her regular patients. And it's like, why not? See patients all over, right? So drmichellehenry.com is how you can reach her. And Dr. Michelle is also on Instagram. Her Instagram is also Dr. Michelle Henry. Abra is also on Instagram. And the salon Instagram is AK Hair and Healing, correct?
Yes. .com.
I like that.
Yeah.
And that's our website too. AK, short for abracadabra. So akhairandhealing.com. So that's our Instagram, that's our Facebook, and that's our website.
Yep. So you guys definitely can get in contact with them if you have other questions. I know a lot of people were looking for recommendations. I will tell you, blackdoctor.org is a fabulous website. You can put in the specialty you're looking for and the city and state, and you should be able to find that doctor. For trichologists, I would speak. I would speak to, for trichologists, I would speak to your stylist and see if they possibly could refer you to somebody, or ask your dermatologist if they knew someone. Because like Dr. Michelle said, there are specific stylists that she works with. So if you ask your dermatologist, perhaps their stylist that they would suggest you go to, because they know that stylist knows how to take care of hair. I was recommending a stylist in Chicago today, and I said, she is actually concerned about you looking good, but she wants your hair to be healthy. And I think that the two go hand in hand. I don't want to look like a nut, but I also would like my hair to be healthy, And so I know back in the day, there was a lot of things that we did to our hair that probably was not healthy for it, but we looked good on Friday night, didn't we? So you guys want to make sure that you find a stylist that does both things, because it is very important. So you guys, that is all we have for today. I see somebody else in Michigan. I'm in Michigan currently myself. That's all we have for today. But please know I will definitely post their information in the post for this video. And of course, you can share away and let people know. I see somebody's looking for a doctor in Hampton Roads, Virginia. Like I said, go to blackdoctor.org. You should be able to find this information. And thank you so much, ladies, once again for joining me.
Thank you.
I so appreciate it. Yes.
Thank you.
I said, hair loss awareness month. What? I said, oh my goodness. And I mean, this is something Black Doctor, if you go to blackdoctor.org, they have tons of posts, blog posts about it. A lot of people obviously want to talk about this. So a lot of women and men were tuning in today. So thank you so much. And we will see you next time. Thank you, guys.
Bye.